Hello juniors, so I welcome you all in a series of lower limb, and today we are going to cover an important topic which is the knee joint. In today's topic we will be covering its introduction, articular surfaces, ligaments, relations, blood supply, nerve supply and movements at the knee joint. So this is a picture of a knee joint, and without wasting any further time, let's move ahead. So starting with the introduction of knee. Knee is the largest and most complex joint of the body, as there is fusion of three bones in one joint. The bones which constitute joints are femur, tibia and patella. I'll show you this in a minute. Knee joint is a hinge type of synovial joint, that is, there is movement in only one direction, and synovial joint means the joint is surrounded by fibrous capsule with a synovial lining. Showing you the synovial lining, if this is the joint, the whole joint is encapsulated in a synovial lining, that therefore it is called as a synovial joint. Coming to the articular surfaces refers to the area where two or more bones meet and articulate with each other. So, surfaces of joint bones which stay in contact with another bony surface. Here is the diagram to make you this thing fit into your mind. This diagram. This diagram has a tibia. This is the tibia bone. This is the fibula bone, and this is the femur. This is the inferior part of the femur. To view the articular surfaces of the joint, the knee joint is flexed in this diagram, and to orient you with the movement, I have taken a picture of this person sitting like this. Here the person has flexed the knees. So in context with this diagram, the tibial bone is right here. This is the tibial bone, this is our fibula bone, and over here lies the femur. Once again, this is the tibia bone, here is the fibula bone, and over here lies the femur as shown in context with this diagram. So these surfaces right here are the surfaces which stay in contact between the bones to form a joint. The articular surfaces are as follows: the medial and lateral condyle. Condyles are these bumps present at the end of femur and tibia bone. Medial and lateral tibial condyle and patella. All these surfaces are articular surfaces of the bone and forms the joint. Now coming to the ligaments. The knee joint is highly strong joint because it is supported by many ligaments. So here I have listed all the ligaments, important ligaments for you to know from university point of view, which are as follow: fibrous capsule, ligamentum patellae, tibial collateral or medial ligament, fibular collateral or lateral ligament, oblique popliteal ligament, arcuate popliteal ligament, anterior cruciate ligament, posterior cruciate ligament, medial meniscus and lateral meniscus. Now one by one I'll teach you each ligament with the help of my 3D anatomy app. Starting with the fibrous capsule. It's a thin capsule which covers the entire joint. As I've already told you in this diagram, it's a capsule which covers the whole joint, thin fibrous capsule which covers the whole joint. Second, we have the ligamentum patellae. So we are viewing the diagram, we are viewing the ligamentum patelli from anterior view. So this is our bone, femur, tibia and fibula, and the ligament here shows is the ligamentum patelli. Ligamentum patelli connects patella and tibia and extends from patella to tibial tuberosity. So showing you the tibial tuberosity. Here is the tibial tuberosity. If here was our patella, so the ligamentum extends from patella up to the tibial tuberosity. Here what is shown in this diagram. Coming to the third ligament, which is the medial collateral ligament or tibial collateral ligament. It connects the femur with the tibia. To view the ligament, we are viewing the joint from medial side. So if this is our knee joint, we are viewing from this point of view. Here we are viewing the tibial collateral or medial collateral ligament. Here is the ligament. The fourth ligament is the lateral collateral ligament or fibular collateral ligament. This ligament joins the lateral condyle of tibia to the fibula, and to view this ligament we will viewing the knee joint from lateral side. So if this is our knee joint and we are viewing from the lateral side, this is our point of view. So the fibula is visible here, so we are viewing from lateral side. Our fifth ligament is oblique popliteal ligament, and to view this ligament we'll see the knee posteriorly. So this is the posterior view. Here is the femur bone, here is the tibia bone and the fibula. So the point to remember here is fibula is always lateral to the tibia bone. So this side is our lateral side and this side is the medial side. So this is a oblique ligament which connects the lateral condyle of femur to the medial condyle of the tibia. And in the same diagram you are able to see another ligament which is the arcuate popliteal ligament. This ligament has two bands. The first one is the medial band and the second one is the lateral band. So the big picture is that all ligaments which we discussed above, all of them support and strengthen the knee joint. Our last two ligaments are anterior cruciate ligament and posterior cruciate ligament. To view the ligament, we will again go back to our previous page. Here is you are able to view these two ligaments which are crossing each other and therefore named as cruciate ligaments. The anterior cruciate ligament begins from the interior part of the tibia and runs upward, backward and laterally and is attached to the posterior part of medial surface of lateral condyle of femur. Similarly, the posterior cruciate ligament begins from the posterior part of tibia, this from right here, and it runs upward, backward and medially and is attached to the lateral surface of medial condyle of femur. So here is the medial surface of lateral condyle of femur to which the arcuate ligament attaches, and here is the lateral surface of medial condyle of the femur to which the posterior cruciate ligament attaches. Now covering the relations of the knee joint, starting with the anterior relations. So the structures which are present anterior to the knee joint are anterior bursa, So what is a bursa? Bursa is a fluid-filled sac which reduces the friction in between the joints. Secondly, the ligamentum patellae and patellar plexus of nerves. So this is the anterior view of the knee joint. This is the anterior bursa. This is the ligamentum patellae, and here is the patellar plexus of the nerves. Now coming to the posterior relations. So the posterior relation is further subdivided into middle posterior, posterior lateral, and posterior medial relations. So the popliteus vessel and tibial nerves comes under the medial posterior relations of the knee joint, which means that the popliteal artery and popliteal vein along with tibial nerves come just posterior to the knee joint. They are middle and posterior to the knee joint. They are neither medial nor lateral. Lateral head of gastrocnemius, plantaris and common peroneal nerves, they comes as posterior lateral relations. So the plantaris muscle right here and lateral head of gastrocnemius muscle and common peroneal nerve. The common peroneal nerve runs beneath the muscle, therefore you aren't able to view this in the diagram. So all these three structures come under the posterior lateral relations, that is, they are lying posterior to the knee joint but they are little bit lateral from the central line. The medial head of gastrocnemius, semitendinosus, semimembranous, gracilis and popliteus. All these are the posterior medial relations of the knee joint. That is the gracilis muscle. This one is the gracilis muscle. The semimembranous and the semitendinous muscle and the medial head of gastrocnemius muscle. They are also the posterior relations of the knee, but since they are medially from the central line, therefore they are under the heading of posterior medial relations of the knee joint. Now coming to the medial relations, sartorius, gracilis and semitendinosus. As I have already told you, this is our sartorius muscle, this lying medial most, gracilis muscle right here and semitendinosus muscle right here. Nextly, the great saphenous vein with nerve. So great saphenous vein, if this is the anterior view of the knee, so the great saphenous vein runs right here accompanying the nerves. So it is lying medial to the knee joint and semimembranous. As I have already told you, right here is the semimembranous muscle. The lateral relations of the knee joint are bicep femoris and tendon of popliteus muscle. So this is the bicep femoris muscle. It has two heads, the short head and long head. They are lying laterally to the knee joint and tendon of popliteus. Here you have seen the popliteus is lying posterior medial, but since the popliteus muscle is a triangular muscle, so its tendon lies lateral, but its main muscle lies medial in the, here lies the tendon of the popliteus muscle and here lies the head of the popliteus muscle. Now coming to the blood supply of the knee. So the blood supply to the knee is by various branches of various arteries, like here femoral artery, popliteal artery. They gives the branches to the knee, and those branches anastomose with many other various branches, and they form a network of artery which supply the blood to the knee. So blood supply through arterial anastomosis around the knee. To remember the blood supply of artery, there are 5 chief arteries and their related branches which supplies the knee. So the popliteal artery gives 5 genicular branches. So here is the popliteal artery and its 5 genicular branches. The word genicular is derived from Latin geniculum, which means knee. So superior lateral genicular artery, superior medial genicular artery, inferior medial genicular artery, and inferior lateral genicular artery, and lastly the middle genicular artery. These all 5 arteries are itself the branches of popliteal artery. So the second artery is femoral artery, descending genicular branch. Genicular against means related to the knee. So the femoral artery gives descending genicular branch. So this is the femoral artery. It gives this branch, that is descending genicular branch of femoral artery. Thirdly, descending branch of lateral circumflex femoral artery. Here in this diagram it is not shown lateral circumflex femoral artery. So somewhat like this, lateral circumflex femoral artery, and it gives a branch called descending branch of lateral circumflex femoral artery. Fourthly, two recurrent branches of anterior tibial artery. The femoral artery continues to the popliteal artery, and then popliteal artery divided into posterior tibial artery and anterior tibial artery. So this anterior tibial artery gives 2 recurrent branches right here. This is the anterior view, this is the posterior view. This anterior tibial artery gives recurrent branches. Recurrent means they are going upward to supply the knee. So 2 recurrent branches of anterior tibial artery, circumflex fibular branch of posterior tibial artery. Once again, the posterior tibial artery, as not shown in the diagram, circumflex femoral artery. It also gives the branch which supplies to the knee. So the big picture is there are 5 major arteries and their related branches which supplies the knee. Now coming to the nerve supply. So the way I used to remember the nerve supply of knee is through a mnemonic called needed OTP fast. Here N stands for nerve supply, O stands for obturator nerve, T stands for tibial nerve, P stands for common peroneal nerve, and F stands for femoral nerve. So you have to learn the name of chiefly these four nerves: femoral nerve, tibial nerve, common peroneal nerve, and obturator nerve. The way I used to remember was needed OTP fast. If you know any other mnemonic, it would be better for you to learn by your way. Now coming to the movements at the knee joint. So basically the major movement at the knee joint is knee flexion and knee extension. A slight of small degree movement is medial and lateral rotation of the knee joint. Here I have a video for you and I'll show this to you. So here is the flexion and extension at the knee joint, and here is the medial and lateral rotation. A bit you can appreciate the amount of movement, that is flexion and extension, but here a slight medial and lateral rotation of knee joint is seen. So these are the two types of movement at the knee joint. Done with introduction, articular surfaces, ligaments, relations, blood supply, nerve supply, and the movements of the knee joint. In the next video, we'll cover the locking and unlocking mechanism of knee joint. And if you found this video helpful, do like it, do share it with your friends. Thank you.